As we age, it's easy to assume that our sex life will naturally decline, and in some ways that's true. But it doesn't mean desire disappears or that intimacy has to fade. In fact, for many people, the later years can bring a more meaningful, emotionally rich, and even more satisfying sexual connection. Today we're diving into some of the most common sexual challenges people face in old age and, more importantly, how to overcome them naturally, without shame or pressure. This video isn't just about sex. It's about connection, closeness, and how to reclaim vitality in a chapter of life that deserves more celebration, not less. Let's start with one of the most common issues, decreased libido. For both men and women, hormonal changes play a big role. Testosterone levels drop in men, estrogen drops in women, and both can lead to lower desire. But here's the good news. Desire doesn't vanish, it changes. It becomes less spontaneous and more responsive. That means you might not feel in the mood out of nowhere, but with the right emotional and physical stimulation, desire can still blossom. The key is understanding your body's new rhythm and not comparing it to how things were in your 20s or 30s. Natural ways to support libido include regular exercise, reducing stress, and boosting emotional intimacy with your partner. Sometimes a walk together, a deep conversation, or even laughter can do more for your sex drive than any pill. Now let's talk about physical discomfort. For women especially, vaginal dryness is a real issue post-menopause. Estrogen loss causes thinning of vaginal tissue, which can make intercourse painful, but there are gentle natural solutions. Regular use of water-based lubricants or vaginal moisturizers can make a huge difference. Coconut oil is another natural alternative many women swear by. Staying sexually active, even with non-penetrative touch, can also improve blood flow and keep tissues healthier. Don't underestimate the power of touch, kissing, and emotional closeness. All of these things can ignite the brain's arousal system and create a space for connection, even when things feel physically challenging. Men often face a different kind of hurdle: erectile changes. Slower erections, less firmness, or trouble maintaining an erection are incredibly common with age. But this isn't the end, it's simply a new phase. Erections become less automatic and more dependent on direct stimulation, both mentally and physically. The good news is there are natural tools to help. Regular cardiovascular exercise can improve circulation. Deep breathing and mindfulness reduce anxiety, which is often the invisible culprit behind performance issues. And here's a powerful truth. Most partners are far more interested in emotional connection and shared pleasure than in perfection. Communication is the ultimate aphrodisiac in long-term relationships. Another big challenge: fatigue and health-related limitations. Aging bodies deal with pain, stiffness, medication side effects, and chronic illnesses. It's easy to think sex just isn't worth the effort anymore. But here's the shift. Redefine what sex means. It doesn't have to be a full, vigorous physical act every time. Intimacy is about shared pleasure, holding, massaging, exploring new ways to connect. Take advantage of comfortable positions, experiment with pillows or support cushions, and most importantly, listen to your body. Your sex life doesn't need to disappear, it just needs to evolve with your changing body. Mental blocks are also very real. Shame, embarrassment, or self-consciousness about your aging body can keep you from initiating intimacy. For many older adults, a negative body image becomes a barrier. But your partner, especially if you've shared decades together, is likely not focusing on wrinkles or sagging skin. They're craving closeness. Rewriting the narrative about aging bodies can be liberating. Start by appreciating what your body can do, not just what it used to do. Meditation, therapy, and even journaling can help release shame and build confidence. Remember, you deserve pleasure at every stage of life. A major emotional barrier in old age is the fear of rejection. This happens a lot in long-term relationships that have gone through dry spells. You might think, if they haven't wanted me in years, why would they now? But don't let old assumptions block new experiences. One heartfelt conversation can reignite intimacy. Try starting with, "I miss feeling close to you. Can we find our way back?" Vulnerability is courageous, and in relationships it often leads to reconnection. Let's not forget about grief and loss. For many older adults, the loss of a spouse or long-term partner creates a deep void, not just emotionally, but physically too. The idea of being intimate again can feel impossible or even disloyal. But intimacy isn't just about sex. It's about healing, bonding, and being seen. Whether it's forming a new relationship or reconnecting with your own sensuality through self-touch and mindfulness, healing is possible. You are allowed to want closeness again. You are allowed to feel desire again. And when you're ready, there are safe, gentle ways to explore that part of yourself. So, how do we overcome these challenges naturally? The key lies in small, consistent habits. Move your body every day, even if it's just a walk. Eat foods that support heart health like leafy greens, berries, and healthy fats, which also boost sexual health. Prioritize quality sleep and reduce alcohol, which often disrupts libido. Most importantly, talk to your partner. Open, honest communication is more powerful than any medication. Talk about what you both miss, talk about what feels good now, and give yourselves permission to rediscover each other without pressure or timelines. Technology and education can help too. There are pelvic floor therapy apps, guided meditations for intimacy, even books and podcasts tailored to older adults exploring sexuality. Consider speaking to a sex therapist who specializes in aging. There is absolutely no shame in seeking support. In fact, the people who do often report more satisfying, connected relationships, physically and emotionally. Another critical yet often overlooked aspect of sexual challenges in older age is emotional vulnerability and intimacy fears. Many people assume that older couples have it all figured out, that decades of being together means comfort and ease. But the truth is, aging brings about changes in how we feel about ourselves and how we relate emotionally to our partners. Body image issues, fear of not being desirable, or unhealed wounds from earlier years can creep into the bedroom and silence desires that were once vibrant. It's important to recognize that vulnerability can actually become a strength at this stage. Couples who open up about their fears and insecurities around sex without judgment often find their intimacy deepening in ways they never imagined. A simple conversation about what each partner needs emotionally can reignite a connection that goes far beyond physicality. Then there's the challenge of routine. Many long-term couples fall into predictable patterns, not just in daily life, but also in their intimacy. While routines provide stability, they can also dull the spark. This is why introducing novelty, whether through new settings, gentle experimentation, or even a shift in how intimacy is approached, can be revitalizing. For example, a couple might try giving each other sensual massages, not necessarily leading to sex, but simply to reconnect physically and emotionally. And these small, intentional acts rebuild the bridge between comfort and excitement, which often fades with age unless nurtured. We also need to talk about communication barriers, because they are far more common than people realize, especially when it comes to discussing sexual dissatisfaction or needs in older age. For years, many grew up in cultures or relationships where sex wasn't openly discussed. As a result, asking for what you need in bed or expressing what doesn't feel good anymore can feel awkward or shameful. But avoiding the conversation leads to unmet needs and emotional distance. Overcoming this starts with soft honesty. Using phrases like, "I miss feeling close to you," or "I'd love to try something different together," creates safety rather than defensiveness. Sometimes couples benefit greatly from seeing a counselor or sex therapist to bridge that gap. Remember, it's never too late to learn how to talk about what matters most. Another factor that deserves attention is sexual trauma and its long-term effects. Some older adults may still carry the emotional residue of past sexual trauma or abuse, and it may become more present as the body changes. The slowing down of life, the quiet moments in retirement, or the rekindling of intimacy after years can sometimes bring old wounds to the surface. If you or your partner have ever experienced this, know that your feelings are valid and healing is possible at any age. Trauma-informed therapy, support groups, or somatic practices like gentle yoga and breathwork can help restore a sense of safety in your body and your relationships. Let's not forget about solo sexuality and self-pleasure, another area surrounded by stigma in older age. As people age, especially those who are single, divorced, or widowed, they might suppress their sexual needs, thinking it's inappropriate or not for them anymore. But sexual desire doesn't retire just because society says it should. Exploring your own body through self-touch, fantasy, or even erotic literature can keep your sexual energy alive and connected. Masturbation also has tangible health benefits, reducing stress, improving sleep, and even supporting hormonal balance. It's a beautiful, shame-free practice that can help you stay attuned to your body and its evolving needs. One more issue that deserves serious focus is the impact of caregiving on intimacy. In many relationships, especially in older couples, one partner may become the primary caregiver for the other due to illness or disability. This caregiving role can change the dynamic from romantic to medical, from partners to patient and nurse. While this reality is deeply human and compassionate, it can unintentionally place intimacy on hold. In these situations, couples need to find new ways to nurture closeness that don't feel like work. Even small acts, holding hands, slow dancing in the kitchen, watching a romantic movie together, can rekindle emotional closeness and preserve that feeling of being lovers, not just caregivers. Now, let's address cultural and religious beliefs that may affect sexual expression in older adulthood. Some people internalize shame or guilt around sex that comes from earlier religious teachings or societal conditioning. Thoughts like sex isn't for old people or it's wrong to feel this way at my age can become internal barriers. It's essential to challenge these outdated beliefs and redefine your own relationship with pleasure and love. Everyone deserves affection, touch, and connection, regardless of age. If spiritual or cultural values are important to you, you can find ways to honor them while still embracing your human need for intimacy. One of the most empowering tools in this journey is education. Sadly, sex education often stops in high school. But why? As we age, our bodies evolve, our needs shift, and the conversations need to continue. Staying informed about your changing body, new ways to experience pleasure, or tools like lubricants, pelvic floor exercises, and hormone therapy can give you back control and confidence. Online resources, senior wellness classes, and even sex-positive books for older adults are incredible gateways to knowledge that liberates. We also can't ignore the importance of lifestyle habits. Simple things like maintaining a healthy diet, staying active, managing stress, and getting quality sleep have a profound effect on sexual health. For men, these habits can support testosterone levels and blood flow. For women, they help balance hormones and reduce vaginal dryness. These lifestyle choices are the foundation of good sexual health, and they're completely within reach. Adding in herbal support such as maca root, ginseng or ashwagandha with proper guidance can also naturally support libido and energy. Let's speak to the importance of redefining what intimacy means. Sex in older age doesn't have to look like it did in your 20s to be meaningful, passionate, or satisfying. For many, it becomes less about performance and more about presence, less about orgasms and more about connection. Whether it's long cuddles, heartfelt conversations, gentle touch, or playful exploration, intimacy is a spectrum, and it expands with age, not shrinks. In fact, many older couples report having the best sex of their lives, not because of their physical stamina, but because of their emotional depth, their patience, and their ability to truly see each other. Now, another critical aspect of later life sexual challenges that doesn't get discussed enough is, well, the emotional toll that comes with aging. As people grow older, they often go through transitions that deeply affect self-esteem and body image, whether it's dealing with weight changes, wrinkles, sagging skin, or post-surgery scars. For many seniors, there's a silent internal struggle. Am I still desirable? This question echoes in the minds of many, especially after decades of being someone's partner, or in the aftermath of divorce or widowhood. And when we don't feel attractive, our desire to be touched, seen, or even acknowledged sexually tends to shrink. So how do we combat this? First, we have to redefine what attractiveness means in later life. It's no longer about youthful perfection. It's about connection, warmth, and presence. It's about embracing your body for the journey it has taken you on and understanding that sexual appeal is more about emotional energy than physical perfection. Affirmations, therapy, and open communication with a partner can do wonders. Don't underestimate the healing power of someone saying, "You are still beautiful to me," or even better, saying that to yourself in the mirror. Then there's the fear of performance. Many older adults experience anxiety over whether they can still perform like they used to. For men, this might show up as erectile issues. For women, it might involve difficulty with arousal or lubrication. These challenges can create a cycle of avoidance. Fear leads to withdrawal, which then leads to emotional distance, which then diminishes desire even further. The natural solution? Start with slowing down. Senior intimacy isn't about racing to a finish line. It's about presence, touch, and sensuality. Use sensual massages, take warm baths together, or just explore each other's bodies in new ways without focusing on intercourse. This shift in mindset can reduce anxiety and increase pleasure. Let's also talk about medications. Seniors are often on medications for high blood pressure, diabetes, depression, and more, and many of these can directly interfere with sexual function. But here's the part people don't talk about. You have options. If your medication is affecting your libido or physical response, speak to your doctor about alternatives. There may be different drugs, dosages, or supplemental remedies that support both your health and your intimacy. Now let's explore the psychological side unresolved past trauma. Many people carry emotional wounds from childhood, past relationships, or even cultural shame around sex. In later life, when everything slows down and we're left with more space and fewer distractions, these buried experiences often resurface. They may manifest as avoidance of intimacy, shame around pleasure, or even, a complete shutdown of sexual interest. We also need to acknowledge grief. For those who've lost a long-term partner, the journey of becoming sexually active again, especially with someone new, can be daunting. There's the guilt, the comparison, and sometimes a fear of betrayal. Now, let's not ignore the LGBTQ+ seniors who face unique challenges. Many grew up in eras where their identities were not accepted, and even in old age they may not feel fully safe or seen. For LGBTQ+ seniors, finding affirming medical care, community, or even a partner can be more complex. But progress is being made. There are now therapists and support groups specifically tailored to older LGBTQ+ adults, offering spaces where healing, connection, and sexual exploration can thrive without shame. Another overlooked area is touch deprivation. As people age and live alone, whether through divorce, death, or life transitions, they often go long stretches without any kind of human touch. This lack of physical contact leads to depression, anxiety, and a deep sense of disconnection from one's body. The solution here is simple yet powerful: non-sexual touch. That could be through hugs, cuddling, massage therapy, or even pet ownership. When we reconnect to the physical through consistent, loving touch, our sexual energy often begins to reignite naturally. Let's also touch on intimacy in long-term relationships. After decades together, sex can start to feel repetitive or emotionally distant. Couples might lose their curiosity about each other, fall into routine, or avoid the topic altogether. One of the best natural ways to revitalize this is by introducing play and novelty. That might mean taking a dance class together, reading erotic literature, trying new settings or sensory experiences, or even working with a sex therapist as a couple. The point is, intimacy must evolve. The couples who thrive are those who are willing to adapt, explore, and keep asking the question, what else is possible for us now? Finally, it's important to shift how we define success in senior sexual relationships. It's not about how many times a week you have sex or how long you can last. It's about connection, emotional safety, laughter, exploration, and being fully present with someone you care about. The erotic energy in later life is softer, more textured, and deeply emotional, and in many ways more profound than anything experienced in youth. To all seniors listening, it's not over. Your body, your heart, and your desire still matter. You have every right to pleasure, to connection, and to intimacy that feels nourishing. Whether you're in a relationship or navigating solo sexuality, the door to fulfillment is always open. The challenge is not age. The challenge is silence. So keep the conversation alive with your partner, your doctor, your therapist, and most importantly, with yourself. As we wrap up, let me leave you with this. Aging does not mean the end of intimacy. It's simply the beginning of a different kind. One that's slower, deeper, more emotionally rooted. One where every touch, every look, every moment of closeness holds more meaning. If you're willing to adapt, stay open, and nurture your connection with yourself and your partner, your sex life can thrive well into your later years. So whether you're in your 60s, 70s, or even beyond, don't let stereotypes rob you of something so deeply human. Passion evolves, intimacy deepens, and love never ages. If you found this video helpful, please like, share, and subscribe for more deep dives into senior wellness, intimacy, and emotional health. And remember, aging doesn't mean giving up on pleasure. It means rediscovering it with deeper wisdom and compassion than ever before.